Next is File 191431, Resolution Directing the Health Commissioner to develop a plan to implement electronic system for client health care records.
Thank you again,
Alderwoman.
Mr. Chair. This particular file came up during budget as well, and I decided to do a footnote because of, as the Health Department presented, they made us aware that they do not have an electronic system for client health care records, that they do hope to soon acquire one, but they do not have one now. And what I wanted to make sure of is, because we know that it's needed, we know that we should be moving towards it. What I didn't want is there to be any lag time between when we get to the place where we can acquire it and whatever else we need to do to be properly using it. So if we prepare now and plan now for it to come, I think that once it comes, we can hit the ground running. Plus, I think, if I'm quite honest with you, for many of us, it was our first time becoming aware that we didn't already have the electronic system. And if you look at how healthcare is going, like, everything's electronic. So the necessity, I think I kind of did the footnote too, just to kind of put a pin in or exclamation point on the necessity for the health department and the clinics to get and acquire the electronic system. Thank you.
Very good. Thank you. Commissioner?
Thank you again, Mr. Chair. Alderwoman Coggs, we are grateful for your support in this. This is part of rebuilding the health department. Having an electronic health record is a necessary tool for us to be able to serve the community, but also to coordinate efforts to reduce healthcare expenses across all of the other healthcare providers in the area. Especially as we have like large-scale events such as the DNC and other like outbreaks and things like that, we need to have a better system to be able to track clients across the area. Another concern, though, about this too is that, as you can imagine, anything of this magnitude is going to be expensive. So our understanding is that there has been funding set aside to purchase the new system in 2021, and there's supposed to be funding set aside this year for someone to help prepare for that process. So there's a number of databases and data sets and things across all the various areas of the health department, and that will need to be evaluated and brought together to prepare to enter all of that information into a system. It's quite a lofty endeavor. So that is the first step, and then the next step is actually purchasing and training and doing some tech support so that everybody's on the same page in 2021.
Okay, very good. Alderman, go ahead.
Yes, and Alderwoman Coggs, thank you. I know that you've been very consistent in pursuing this issue. And I know our commissioner was touching on what I was going to ask, and I guess it was timeline and cost. I've been racking my brain trying to remember what kind of costs I'll let you ask or answer.
Well, my understanding is the funding for the person, that project, I forget the name of it. It's like a IT position.
Yeah.
Is $100,000.
Okay.
But for next year, I don't know the actual amount for the electronic health record offhand, but we can provide that to you. Procurement, they have their bid process and all of that, but we definitely have been looking at various systems already, and we were hopeful to get something on board sooner. But we want to do things the right way. We don't want to just move fast and patch something in, and then we go back and have to rework things in 6 months or something like that. So we can get that actual dollar amount for you through the budget office.
And I don't ask, you have enough higher priority items. I'm just curious. And I guess the other question is that, so what comes first, infrastructure or the person?
Well, the person to help guide the infrastructure and help move things along.
Very good.
So that's why that funding amount is available for 2020, and then 2021 will be the actual acquisition.
It's part of the large scale.
Yeah. Okay. Yeah. Mm-hmm. Yeah. This is our new Deputy Commissioner of Policy, Innovation, and Engagement. So she's going to be working on a lot of this process as well. So she has experience with these systems.
Okay.
Thanks.
Thank you.
Very good. Thank you, Alderman. Any other questions or comments by committee members? If not, Alderman Borkowski would move approval, and hearing no objections, so